Hi, I'm Dr. Meridian. It's lovely to meet you. You were referred to me by your GP. Everything that happens in this room, I feel I should tell you, stays exactly in this room, as with all doctors. But obviously, the things that you're going to tell me in here can sometimes be a little more sensitive, because that's the kind of GP, that's the kind of practice that we are. We try to keep everything informal. We try to make it feel as if you're not technically sat in a doctor's practice, because that way you're more comfortable. So on that note, please feel free to get comfortable. If you would like to stop at any time, if you would like to go to the toilet at any time, don't worry. Don't worry about it at all. You can go. There is a communal room just down the hall where you can go make a cup of tea if you'd like to, and just take your time. Because everything that we do here can get quite emotional, as I'm no doubt you're aware. It's really great to see that you've made this step. It's a positive sign. I take it as a massive step. I don't know how long you've been feeling the way that you feel, but to have come this far already is fantastic. So you should be very proud to be even sat in front of me. So well done for that. I have your file here that's been sent on from your doctor. I have had a look through it. There's a few things I need to ask you, just a few points that need clearing up, and obviously I just need to confirm that you are who you say you are. I have no doubt that that's the case, because I can't imagine anybody else wanting to jump in to a doctor's surgery under your name. So we're going to do that first, and then I will do a few little tests before we get talking. Just nothing serious, don't worry. It's just I'm going to take your blood pressure and listen to your heart rate. We'll do it at the beginning, and we'll do it halfway through, and we'll do it at the end, just to see how talking about things might affect you. Okay, so I'm just trying to find the page where I'm supposed to take my notes. Okay, perfect. So let's just check my pen's working. Every page more or less has a little scribble in the top, because I check whether my pen's working. Okay, so just confirm your name for me, please. Correct, obviously. And your address? Yep. Okay, and just confirm your telephone number for me. Excellent. Okay. That's all in order, so you're exactly who you say you are, which I didn't have any doubts of. Could you do me a huge favour and just tell me the name of your doctor? It's for some reason not on the file. I know that they've referred you to me, but it's for some reason been omitted from the file. I figured it was probably somebody along those lines, because he's very good at referring people to us when necessary. Yeah. Okay. So that it's just so that if I have any recommendations for medication or anything, I can't prescribe them. He can, I can't. So I have to send him a letter just to let him know what you're on. What I can prescribe them, but he has to sign off on it, just in case you're on any medication for something else that I'm not allowed to know about. Okay? Right. So, we're hoping that it doesn't come to medication now. It would be better if it didn't come to medication, for all involved. I really try to use medication as a last resort, because most medication for anxiety or depression or anything like that can be very addictive, and I find that a lot of people who suffer from anxiety or depression already have rather addictive personalities. I'm not saying that everybody does, but some do, and that makes problems worse. So I try to use medication as a last resort. There are many things that we'll try before medication, okay? So, I just need to ask you a few questions. Starting with, could you tell me your date of birth? Okay. So, perfect. And could you tell me, your doctor says that you were feeling symptoms of anxiety and symptoms of depression. Have you felt them? Do you feel them equally, or is one stronger than the other? Is something does it some days feel like you're more anxious and some days feel like you're more depressed? Okay, so it's a very strong mixture of the two. Okay, no, that's very common. That's very, very common. Occasionally depression is stronger. Okay. And have you always felt them intertwined, or did depression come first or anxiety come first and then the other? Okay. It's very common for that to happen. Anxiety can very often lead to depression, and then they work together to make things feel not very nice. So anxiety came along first, but how long ago would you say that was? Okay, that's a while ago. Have you been to the doctors before now with it, or have you left it until now, or? Okay, you learnt to live with it. Okay, a lot of people do that. Again, completely normal, nothing to be ashamed of, worried about. A lot of people just live with anxiety. For some people, anxiety may not surface very often. It may not be something that they deal with very regularly. Okay, so could you tell me now, how long after anxiety would you say came along? Would you say that depression developed? If you could put a time frame on that. Okay. Yeah. So, I would suggest that you've been living with both for far too long. Anybody who lives with either lives with it for far too long, but you have been living with it for quite some time, so we definitely need to figure out what we can do to help fix you. Okay. So, obviously you approached the doctor. That was, if I look back through your file, so that was 3 weeks ago that you approached the doctor. Yeah. I know we do tend to have a bit of a waiting list here, but the doctor felt that you were an urgent kind of person, so we got you in as soon as possible. 3 weeks is generally pretty fast. Some people are waiting a lot longer than that. There's a lot of people who waste time, so I know that if the doctor's telling me that you need to be seen, then I know that you need to be seen. Okay, so that's perfect. Okay, so what I need to know now is what caused you to actually go to the doctors in the end? Was there a factor that sent you that pushed you a bit further than regularly? Because you've been suffering with both for quite some time, so to suddenly go to the doctors would suggest that there's been a trigger, what we call a trigger, which may have just sent you to that point. That must have been awful. Yeah. No words can really be said for something like that. I'm just glad that you were brave enough after that to come and see the doctor, and then to come on and see me. A lot of people will get the courage to go and see the doctor, and they'll be sent the referral, and then they'll not take the referral because they've lost the courage, they've lost the nerve, and it is a very nervy thing that you've done, and you should be very proud of yourself. Seeking help is most definitely difficult. A lot of people don't want help. A lot of people want it, but they don't. It's a difficult circle to be in. Okay, so I have got some more questions, but first I just want to do a quick test. I just want to listen to your heart rate before we get too into this, because I don't want to raise it too much just yet. So, okay, so I need you to just sit back, take a deep breath for me, and just hold it for a moment. Okay, so just on my count of 3, 1, 2, 3. Perfect. Just keep holding that. Okay. Okay. Yeah. No, that's fine. Okay. I'm gonna go around the back of you and do the same, and listen to your lungs just to make sure there's nothing there. Okay. So, just bear with me 1 second. Okay, on the count of 3 again. 1, 2, 3. Okay, yeah. Just keep holding that a second. Okay, let go. Perfect. Okay. So that all sounds great. We don't need to be too concerned about any of that. I will, like I say, do that again in a moment, in a little while. But for now, everything sounded fine. I am going to also take a look at your pupils. This may sound a little intrusive a question, but I just need to know that you haven't taken any drugs, or even that you're not under the influence of alcohol right now, because that will obviously affect how your pupils look to me. No? Perfect, okay. As a matter of interest, have you ever suffered from drug abuse? Have you ever? No. No, I mean, it's just something that you have to ask, because drugs and alcohol can very often cause these kinds of feelings that you've got. Okay, so just looking straight over my shoulder for me, try focusing on the lamp just there, and I will take a good look into your eye, and we will just try and see if we can see anything. Okay, I just need to see if the eye responds at all. Okay, so just sitting still for me. Perfect, thank you very much. Just focusing at the lamp. Excellent. Okay. Yep, now that looks good in that one. We'll just check this one. Okay, yeah. Excellent. Very happy. Okay, so what I want you to do now is I'm just going to take the top off of this, and I just want to check your reactions, make sure that things aren't affecting you. You are on medication from the doctor anyway, aren't you, for back pain? Yeah, so I just want to make sure that that's not affecting your reactions. It could be that because you started taking your back pain tablets quite a while ago, didn't you? So I don't want them. Obviously, the doctor will have considered this, but I want to make sure that they aren't helping to deepen any feelings of depression or anxiety. Okay? Okay, so just looking at the light for me, I want you to just move both eyes at once. Don't worry about doing one. That's very difficult. I just want you to move both eyes whichever direction that I tell you to at the time, okay? So just going to get closer so I can see. I just want you to move both eyes to the right for me. Okay. Excellent. Excellent. And look up for me. Okay. That's excellent. And just look down for me. And to the left. Okay. Yeah. No. Okay. And now what I just want you to do is just follow the light. So I'm just going to be moving the light in and out of your line of sight. I just want you to try and follow it, okay? So we're going to start in the middle. Okay, excellent. Okay, excellent. And now your reaction times are absolutely fine. Yeah, absolutely fine. Okay, very happy there. So I don't think that you're being slowed down by any of the medication that your doctor's been giving you, which, like I say, can cause or deepen, I wouldn't say cause, but it can deepen feelings of depression and anxiety. I did imagine that that wasn't going to be the case because your doctor is very good at checking for those sorts of things. Okay, so I'm going to be asking you some more questions, and then we're going to decide where we go from here. But first, just to try and help you to stay calm and to just, I'm just going to get a little closer, just to try and make you feel a little bit calmer. We're going to try spraying a little bit of this spray around. This is a very calming spray. It's got a heavy scent of lavender, which is extremely good for calming people. Just because some of the questions that I've got to ask you can be a little emotional. So if you're calm instead of being very nervous, then it can help, okay? So I'm not going to spray it on you because you don't want to leave smelling like lavender. You've got some very nice perfume on right now, so I don't want you to be leaving smelling of lavender. So we're just going to spray a little bit around you. And just take some deep breaths for me. We're going to do it together. Okay, so just on the count of 3. 1, 2, 3. Okay, one more for me. And one more. Okay. Does that feel calmer? I feel calmer. Good, yeah. If you want to take some of that spray with you, I have loads of it, so if you want to take some of that spray with you, and then when you're feeling stressed or anxious or anything like that, it might help to just take the spray at the room that you're in a little bit with it. Obviously, if you're sat, I don't know, at work or something, that's not easy to do, but if it does help you, then it might be worth spraying those scents around a little. Okay. Now, just make sure you're very comfortable for me. Take some more deep breaths if you have to. These questions are very generic, and they're going to seem very generic. I just need to ask them before we can decide where it is that we go from here. Whether your next appointment is going to be, I don't know, we could recommend acupuncture, we could recommend seeing the physiotherapist, we could recommend all sorts of things for your next session. But before we can do that, we need to fill in this sort of a survey. Okay, so I already know your timeline. I just need to ask some questions about drug use, which we already know that you haven't had any history of. So you've never taken any drugs at all? There is no judgment here. If you have, you have. It's not something I'm going to judge you for. Okay. No, like I say, no judgment. That was, how long ago would you say? Okay. Do you smoke? Just tobacco. And how often, well, how many would you say you smoke a day? Okay. Perfect. Okay. Do you drink? And how much would you say you drink? Okay. Well, obviously, according to the government guidelines, that's quite a lot over the recommended intake per week for somebody of your age and your gender and your size. Okay, so we would have to look at trying to reduce your alcohol intake regardless. I'm sure that's something your doctor's already discussed with you as well, because that alcohol coupled with the tablets that I know you're on for your back pain, it's not the best combination. Those tablets don't go very well with alcohol. Not that many do, but these ones are particularly not great for with alcohol. So obviously we need to try and cut that down. We can recommend all sorts of treatments for I wouldn't say you've got to a point where you're abusing alcohol, but I would say you're in danger of becoming that level. Okay, so when at work, how much do you work a week, and what is it doing? Okay, so technically classed as part-time. Yeah. Do you enjoy the work? No, not many people do enjoy work, it has to be said. I love my job, but very often people get jobs because they are a job and not because it's what they enjoy doing. Okay, so on a scale of 1 to 10, 1 being not very anxious and 10 being very anxious, if I were to say to you, you've woke up in the morning, you've had your breakfast, and now you're off to work, how anxious would you feel? Okay, that's very high. So work, I would take from that work makes you very anxious. Okay, so using the same scenario on a scale of 1 to 10, how depressed would you say you are feeling? Okay, equally as high, yeah. So I would suggest that your job is definitely not something that you're enjoying, if that's the way it's making you feel. Okay. So do you have the means to look for another job? Do you have the means to... You're not confident enough? Okay, that's fair enough. That's a fair enough point. So on that subject, on a scale of 1 to 10, how confident would you say you are as a person? Not very confident at all, okay. Okay, yeah, that's... A lot of people who suffer with anxiety and depression have very low self-confidence, so that doesn't come as a shock at all. Okay, and back to the job, to your job. How would you say that the job pays well enough to cover your bills? Do you have money worries? Do you worry that you're not going to be able to afford to eat? Okay. So you worry that you won't be able to afford to go out with your friends when they all go out? Okay. And would you say that causes you to feel more or less anxious? I know it's a pretty obvious answer, but... Okay. And would you say that if you were to go out with your friends and you did get a chance and you could afford it, how anxious would you feel then? On a scale of 1 to 10. Okay. So what makes you feel anxious then? Because we've discussed the fact that you could afford it if you wanted to. So what about it, particularly now, is making you feel anxious? Being around other people. Yeah. Now that again, very, very common with people with anxiety. social circumstances can sometimes be hugely anxiety-inducing. Yeah. And again, with the same scenario, a scale of 1 to 10, how depressed would you say that you feel about the prospect of going out with friends? Okay, so it's not the prospect of going out with your friends, it's the prospect that you'll be anxious when you do, which will ruin it for you, that makes you more depressed. Is that what we're saying? Again, that's a very common scenario. Okay, so you've got the day off. You're sat at home, you're comfortable, you're you've got all the chores done, all the house is clean, everything's sorted. You've got nobody else around, it's just you and your own. How anxious do you feel now? You can close your eyes if you want to imagine this scenario. It's perfectly fine, as long as you're comfortable and trying your best to imagine that you are in that scenario. On a scale of 1 to 10, much better. Yeah, that's a much nicer level. That's the kind of level we would want you to aim at for when you're at work or when you're going out with your friends, rather than just when you're sat at home with nothing really to do. On a scale of 1 to 10, how depressed would you feel in that scenario? Okay. Yeah. So your depression is brought down, but not by as much as. Would you say that the reason your depression is quite high is because you have time to think more? Yeah. Okay. So, in this scenario, you've got all this free time. What are you going to spend it doing? What do you do to relax? Okay. So you enjoy reading? Yeah. So you've picked up your book. You're flicking to the page you last read to. You can't wait to see what happens to Harry Potter next. How anxious are you right now? So lower than before. And again, same scenario. Scale of 1 to 10. How depressed are you right now? Perfect. So, because you're now not thinking about it, you've not got time to think, your depression is a lot lower on a scale of 1 to 10, which is exactly where I would expect it to be, but I would hope that we can get it to a point where even when you're going out with your friends or when you are sat at home alone, that your depression is around that level anyway, okay? So, we are very close to being done with the questions, I promise. And then from there, I will be able to summarise what I've learnt about you and try and figure out where we go from here. I'll run a couple of ideas past you, but ultimately the choice is yours. I will give you pamphlets and stuff out in the foyer for you to just decide what kind of therapy you'd like to help with this. Okay. So scale of 1 to 10 again. So you are sat at home, you're reading your book, and the telephone rings. How anxious are you? So what are the first thoughts that go through your mind when when that telephone rings? Who are you dreading it being the most? The bank. Yeah. Now that's probably the same for every single person. That telephone rings and the first thing you worry about is that's the bank telling me that I've got no money left or that something's happened, okay? Second thing, work. Is that because you're worried that work are ringing to ask you to go in? Yeah. So you're in the kind of job where they can just ask you to come in, or they will. The possibility of them asking you to come in is higher than, per se, other people's jobs. Okay, so your anxiety goes through the roof. which I think it probably would for a lot of people. What about your depression on a scale of 1 to 10? That shoots up as well. Yeah, I figured it would. Generally, when anxiety raises, so does depression. But when anxiety lowers, depression can sometimes be a lot slower to lower. Okay, so you get the phone call. It turns out it's just a family member wanting to just ask you how you're feeling. Do you lie to them, or do you tell them the truth? Again, that is very, very common. You've got nothing to feel ashamed of. People find it much easier to tell people, such as myself, in this kind of scenario than to tell a family member. That's just the way it is. But I would say that at some point you may have to tell your family, or at least your immediate family, people that you live with, because you need that support. You need those people in your life to support you as you go down the journey that we're going to go. Yeah. Okay. Nearly there. Okay. So, do you holiday at all? You do? Whereabouts do you go? Do you go somewhere sunny? Somewhere cold? You stay in this country? Is that... You've got dogs. I thought it must be that. Okay. So, the week before the holiday, how anxious are you? And how depressed are you? Again, this is on a scale of 1 to 10. Okay. Would you say that's the fear of packing, the fear of forgetting something? Yeah, I thought it would be. That's, again, very, very common fear. So it's nothing to be ashamed of. Okay, so you get on holiday, you see the room you've booked. I don't know if it's a room, it's a cottage, something. It's beautiful. It's exactly as you imagined, probably better, based on anxiety and depression. How anxious are you now? And how depressed? That's a good sign. Okay. So, we've gone for 2 weeks. Let's say it's a 2-week holiday. You've kept on top of everything at home before you've come, so you know that you've not got to go back to a messy house or anything. Nobody's been in. But it comes to the second day before you come back. How anxious are you? And how depressed? Okay, and is that the fear of coming back to your normal life, to the real world, as it were? Okay. Okay. Last question then. You get back home. You've got all the washing done. You've caught back up with all that sort of thing. You've been out and done the shopping, filled the fridge back up, because, let's face it, nobody leaves the fridge full. You're sat at home and you check your bank balance and realise that you may have slightly overspent on holiday. How anxious are you? And how depressed? And what would you do in that scenario? Would you panic? Would you worry? Would you speak to somebody, your partner, your family, your friends? Would you speak to anybody? Or would you keep all that worry inside? Okay. Excellent. Okay, that's fine. That is, again, very common. A lot of people keep those worries hidden. Right, okay, so let me just read through these notes. Just want to check that I have the right kind of insight. I think I do. I think I think I can come up with three recommendations. Now these recommendations don't have to be one or the other, they can work in conjunction with one another. That's probably the way I would recommend it for yourself. No, we won't go with that one. Okay, I'm only going to give you two, because I think that these two together will alleviate a lot. So, for your anxiety and depression together, I recommend that you have therapy with myself. This is where we will talk things through, we will try and get to the bottom of things. Going through the survey, as we are calling it, that we've filled out, I am inclined to believe that your anxiety is the key factor. It causes your depression, it worsens your depression, and it heightens everything else for you. So I would like to try and get to the bottom of your anxiety before I try and tackle depression. So I would recommend therapy, and then because I believe that your anxiety is your biggest stressor, I recommend acupuncture, because acupuncture is commonly undertaken to alleviate anxiety, and the way I would try and work it for you is that you have an acupuncture once a week, and you have therapy shortly after that, very shortly after it, hopefully within a couple of days after it, so that you are still as relaxed as possible from the acupuncture. Now, I know what you might be thinking, acupuncture is needles are scary, but it's literally like that, and you barely feel a thing. I've had it myself. It's very, very, you come out of it and you're like, you feel much calmer, much more centered. So I would recommend those. You don't have to take either if you don't want to, but I would really, 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 really like to see you back here for a therapy session. Don't worry about cost. You don't have to worry about any of that. You've been recommended by your GP, so that's all covered by the NHS. So you've not got to worry about any of that. Acupuncture, on the other hand, isn't covered by the NHS. However, because I'm recommending you for it, we do offer a discount scheme for those people, and it would be £5 a time. That's for an hour's session, which is if you went somewhere else, if you went and had acupuncture not on my recommendation, it'd be £25 per hour. So I do recommend that you have the acupuncture. Obviously, as you know, I'm not just trying to make a profit out of you there, because £5 doesn't even cover the cost of hiring an acupuncturist in. If you can't afford that, then we can discuss it. We can come up with a payment scheme if that's the route you choose. But it's entirely up to you, and you don't have to make a decision today. Go away, think about things, but try not to get inside your head too much about it. Every session will be similar to this, very relaxed, calm, and obviously you want to take that with you today, so that you can spray some of that around whenever you're feeling anxious at home and stuff. I hope that you're feeling confident, or more confident, about getting to the bottom of this, because I don't want you to leave here worrying that it's still not going to get sorted, because it will. And it's very rare for somebody not to finish a course and a treatment with us not feeling as if they feel much better. There's a general consensus that anxiety and depression cannot be ultimately cured, as it were. They will still surface from time to time, but they surface in every single person from time to time. So it's not because the treatment's failed, it's not because it's not been good enough, it's because that's just human nature, to feel anxious and to feel depressed about things. So I want you to leave here knowing that your best interests are my best interests, your best interests are what I'm thinking about, and I really want to help you, so that you can go out with your friends and you can have a good time, and you can go to work not feeling too like you don't want to be there and like you hate your life because you are. Okay? So you make your decision. If I haven't heard from you, or if you haven't rung to book an appointment with me for within a couple of weeks, then I will try and ring you. That's just the way it works, the way that I like to follow up, because I don't want you to forget about it. I don't want you to have got inside your head, like I said. Okay, so you decide what you want to do. If you've already decided, that's perfect. You can book an appointment with the receptionist outside for either the therapy or the acupuncture, or both if you want to. I will send a note straight out there with you so that they know that if you want the acupuncture, that it's at my recommendation. Okay, it's been a pleasure to meet you, and I hope that we will see you again soon, so that we can really help you. And I'm confident that we can help you. Yeah. Come here, hug. Oh, and this side, look. There we go. Perfect. Okay. Well, hopefully I will see you very, very soon. Okay? Bye-bye.